Welcome. My name is Jason Helgerson, and I'm here to present the latest in our series of New York State DSRIP whiteboard presentations. Today's topic, best practices in DSRIP Year 3. We're really in the midst of the performance period in DSRIP. It's important for all 25 PPSs to up their game and do everything in their power to achieve success for them and their communities. There's a lot riding on this initiative. And really, we are at that point when you really have to be improving health outcomes, and it will be demonstrated in the data and the results in the months and years to come. So as part of that effort to help support the PPSs, we wanted to provide some examples, some best practices of things that are going on right now today that we think should be replicated all across the state. There's a companion document that provides even more examples in these key areas, but we wanted to highlight a few in this video. So first and foremost, Care Compass and its Innovation Fund. We have been encouraging the use of innovation funds as a way to really try new and innovative things and engage different types of organizations, including community-based organizations, to see what they could do to help you in your goals as a PPS. So this is one of the largest, if not the largest, funds that has been created so far by Care Compass out in the southern tier, and they have funded a variety of different initiatives ranging from the largest being a crisis stabilization center to a smaller version, which was a much smaller version, which is a prescription program for fruits and vegetables. Variety of different things being funded, lots of opportunity here for creativity. Strongly encourage you to look at that innovation fund. Next up is Staten Island and its practice in terms of how it's using data. Staten Island's been a leader in this area since the beginning. They have live feeds coming in from providers all across the island that gives them basically real-time information, actionable information. And now what they've done is they've now begun to put that information into dashboards that they can get out into the field, out to organizations, providers, to make that data truly actionable, to change how care is provided. Wonderful example. Encourage you to go visit Joe Conti out on Staten Island to find out more. Next, address the social determinants of health. It's a key part. You can't be successful in DSRIP unless you're able to do that, and we wanted to highlight an example of what's happening in the Finger Lakes. Here's an example of truly breaking down silos. You had the PPS and its efforts to improve health in its community, but a companion effort led by the United Way with funding from the state government to support an anti-poverty effort. They've joined hands, they're working together. These are not siloed efforts, but they are working together in common cause. They're obviously closely related in terms of purpose and need, and we're very excited to have that kind of collaboration in and around Rochester. Next up is adopt an approach to crisis intervention. Crisis intervention could be one of the real game changers in DSRIP, and we're excited to see 3 PPSs coming together, Refuah, Montefiore, and Westchester in the lower Hudson Valley, and they created a crisis intervention center in Dutchess County. It's been only open for a few months, but it's already been a great success. It's an alternative to the emergency room, and it's an alternative to jail. It's a great cross-system approach, which really could be a tremendous win-win for communities and for patients. And we love to see people replicate it. Encourage you to go out to Dutchess County and see it. And then lastly, mobilize around the priorities of your community from the public health perspective. Leatherstockings and Bassett together clearly identified that the opioid crisis was ravaging their community. They have mobilized and they are expanding access to opioid treatment all across their community. They're supporting primary care providers by getting them certified to provide more treatment, and they're also even embedding into primary care practices. Professionals have the ability to work with individuals who are facing the challenge of opioid addiction and getting them on a path to recovery. So another great example of PPSs responding to the needs of their communities. So that's it. It's only a few examples, but hopefully you find this helpful. Encourage you to go to the website and see the rest. Thank you very much.